Kayla, and I'm going to talk about arterial lines. So an arterial line is a venous catheter, or a catheter that looks like an IV that goes into the artery. Typically it goes into the wrist, the radial artery, but occasionally when they can't get one in the wrist, they'll put one in the brachial artery and the AC, or in the groin and the femoral artery. We put those in to give us beat to beat blood pressure, so we can control blood pressure much better, and it gives us access to blood draws if they're going to need like a lot of them. So instead of just sticking them a lot, we put an arterial line and we have easier access. So they're actually great for blood pressure management. They give you a little bit more information than you have with the non-invasive, and for patients that have any kind of clotting disorders, or like old people that have a lot of plaque, it gives you a more accurate blood pressure than a non-invasive blood pressure cuff. So I'm going to show you how they come, this in case you have to set one up. This is a pressure bag. It holds air and creates pressure on the saline.
We used to have to use heparinized saline, and now we just use 0.9.
Okay, well. So it comes in a kit like this, and they have, there's like a double and a triple. You probably won't see those. They use those more for when they need CVP monitors and PA numbers.
Before you get too much air in your bag, spike it, in case you, that way if you go through the side wall of the bag, you won't be wearing it all.
Just close your roller clamp like you would IV tubing. Push the air out of the syringe and you'll hear it click. And then open your, so this little guy, you probably all know this, but it has like a green band on it that'll give you like the appropriate pressure, and then above the green is red. You really want to keep it in the green. If you see it like deflate a little bit, I think that it says, like the packaging says, I think it loses a couple mLs every 4 hours or something. But you really want to try to keep it in the green, because it will keep your catheter patent, because you're fighting with the blood pressure. So if you have a systolic blood pressure of 120, if you're only at, you know, lower pressure here, it's going to clot off and you won't be able to use it. So once you get it spiked and the roller clamps open, you just go to this piece and pull the tongue and wait for it to squirt out the bottom. So then it squirts out the bottom. You want to check the tubing. It's really important that you make sure you don't have any air, because it is going into an artery. And then you're good to go. And then this guy, the back part of the tongue sits on the holder, and this guy goes down. And it doesn't really matter what color you put it in, unless you have 3 and you're trying to color code them. But then this little guy will flip around, and he has the groove too. He can go right there. And this will hang on the pole, just like that. And you want to make sure that this is leveled at the 4th intercostal space mid-axillary line, which is like the right atrium or the phlebistostatic axis. And that will give you the most accurate pressure. If it's too high, your pressure will read low. And if it's too low, your pressure will read high. You want to make sure it's leveled. In the unit, they say like every 4 hours, but you guys don't typically have patients that long. So anytime like the patient's moving around, you look around, it's on the floor, or you get a big change in your blood pressure, it's a good idea to re-zero it. So we're gonna hook it up to a saline bag, just so if you don't have experience with them, or if you'd like to refresh yourself, you can do that.
So you just hook this up to your A-line catheter, and this way you can practice. So if you want to do a blood draw, you can poke a needle in here and aspirate, but you have to clean it off and make sure it's sterile. Now the other way is if you take this and you turn it off to the patient, and then you can draw back on this plunger. There we go. You can draw back on the plunger. This is technically the artery. This is the artery, fill your syringe up.
So the point of filling the syringe up is getting like the 10 ml waste like you would if you pull
Yep.
off central line.
And you want, I brought a syringe.
And also when he clicked this open, when you click it close, you'll hear it click. To get it to unlock, there's like a little tiny piece of plastic and you just kind of squeeze them together and then you can withdraw. And then you just, this has to be done with gloves and stuff, you guys know that. Just put the syringe on here.
And this would be filled up with blood then. Here you go.
You gotta be open.
Yeah.
So you pull it. There we go. So this has to be up and down, and this has to be down.
And you can turn that back. You can take your,
And you take the syringe off.
and then to flush it back, you can flush it back here. The one thing, we didn't flush this enough, but there's, when you're filling these and you tap them, I always tap them real good because you get air pockets in these, and so we're real careful when we flush them that we get all the air out of it, because you end up with some air in them if you don't. But
So if you're pulling like a, correct me if I'm wrong, if you're pulling like a hematocrit or something, and you don't want to get this waste blood, your best bet is to use a needle and draw it out of this. Otherwise, you're going to get waste. And you can also flush it, which all you need to do to flush it is just pull the tongue, and you'll flush it from this bag back into the patient.
and they deliver, like she said, they deliver I don't know if it's how many cc's an hour this will let go through the tip to keep them patent on the patient, versus an IV where you have to flush it all the time. And then zeroing it, did we talk about zeroing it?
Yeah, you put this at the level of the heart, and then
Off to the patient. So this little thing, you turn off to the patient, and then you open this to air. You'd hit 0 on your monitor. Once it zeros, you put this back on, turn it back here, and then it's going to read your pressure onto your monitor. The biggest thing, if you're setting it up, the biggest thing is kind of flicking these when you're flushing the fluid through them. Always check these connections up here, like see this one's loose. Sometimes they don't come tight. I've had them come apart there, but just kind of flick all the things when you're flushing the air or flushing it through, and it'll get those bubbles to come out of it, and you can flush it out the tip before you hook it up to your patient.